Dr. Sue McLoughlin is a physician and co-owner of Medi-Cal Family Care and Walking Clinic. She earned her medical degree at UBC in 1985. A few years later, because of her special interest in tropical medicine, nothing to do with our climate here in British Columbia, Dr. McLoughlin worked in Zambia for 2 years. And in 1998, she and her husband Mike opened their first walking clinic, Medi-Cal, in Kelowna's Dilworth Shopping Center, and they later opened another 2 clinics in the Kelowna area.
Is that doctors are people too. And so from my perspective, that's a good thing and a not so good thing, doctors being people. With the supply and demand question, we're the ones feeling squeezed, and we are feeling very squeezed. I have worked in a walk-in clinic. I've had a family practice as well, from which I retired almost 2 years ago. Now I'm currently doing a lot of surgical assisting in the hospital, and I do some walk-in shifts as well. I find myself trying to support our own walk-in clinic doctors. We have 3 who have their own family practice and do walk-in shifts, and 1 who does mostly walk-in shifts. We have a lot of trouble covering the evenings, and especially the weekends, because they're already working full-time, and they're people too, and they get burnt out. They need a little bit of time off. They need their weekends off. They need their weekends to recharge. We, for quite some time, had a doctor who was in his 80s working for us. He was doing some of our walk-in shifts on the weekends because we couldn't find anybody else to do them. The fact is, he had to learn how to use EMR. He needed a lot of assistance, and he was fairly slow. He actually did a good job with patients, but he could not get through a high volume. So there were instances where there would be more people at the clinic door when we opened than he was physically able to see in his shift. So I knew that it's very hard to turn away people if they've been waiting there before you open the door. So on days where I knew he was there on the weekend, I would come in on my day off and help him out for a few hours so that we could at least take all the patients who were there when the clinic doors opened. And as soon as we registered those, we would say we can't take any more. But at least we could manage those if I was there. But the problem was that was my day off. And I find more and more on my day off, I have to go in and help out. You know, there's a week coming up where we don't have anybody to do the evening shift, so the request has been made of me, you know, can you come in after you work a full day in the operating room, can you come and do a walk-in shift? And that's not unusual that happens, but I've done that time and time again, and it gets to the point where I'm saying, you know what, I just can't keep doing that. And sometimes I just have to say no, and sometimes we just have to close. So what's happening is we're at the point, and we've seen it happen in other clinics in Kelowna, etc., where we just have to close. We want to keep the doors open. We want to service the public. Our heart is to really be there for people and provide medical care. But on the other hand, we feel that for years we've been marked as the bad guys. Well, the walk-in clinic doctors, they don't do a good job. And so we carry this load of people saying that we're bad doctors, and we know that we're not. In fact, one of the doctors in our clinic won an award from the Canadian Family Practice for having the highest marks on the exam. And people just say she's a bad doctor because she works in a walk-in clinic. I mean, it's just absurd, and yet we still feel that on us. We feel people loading things more and more on us, and there's no incentive for me to go in and work on a Sunday, because if I see a patient on a Sunday with a mental health issue, let's say they're depressed, let's say they're suicidal, let's say I need to take at least half an hour with that patient. If I'm in a regular family practice and I've committed to ongoing care with that patient, I can bill a certain fee and get paid a certain amount for that visit, which will compensate me for the time and effort I put into that. If I'm a walk-in doctor and I spend the same effort, but I specifically myself have not committed to follow up that patient, even though they're coming back to my clinic and they're going to be seen by the doctors I work with, I still can't bill the same fee. So I get paid less. So there I am on a Sunday afternoon working, managing these people in a place of crisis. And usually on weekends we are seeing people who are in some sort of crisis. Otherwise, why would they wait 4 hours to come and see us? Usually they're not just there for something simple. So anyway, I feel like I don't get paid as well as someone would. So the incentive has been to move people towards full-service family practice. And I think full-service family practice is great. I have nothing against that. But the problem is we do have all these people who just do not have access to those full-service family practice doctors. And those of us who are trying to manage these unattached patients are really feeling the pressure. And we're at the point where we're saying, you know what, maybe we should just close. Maybe we should have a walk-in clinic open on the weekend, because what's the point?